All right. Well, everyone, thanks for joining us today. My name is Foxy from the Seattle Sickle Cell Task Force. I'm super glad to be here with some amazing folks. And today we're really going to be talking about the flu and just learning some history about the flu and what we should be doing as families with sickle cell or other chronic illnesses. Just want to know about what we should be doing around the flu, what we should understand. So first, I just want to say thank you to all of you for joining us today. And if you don't mind, just introducing yourself, telling us your name and maybe what you do. We can start with, on my screen, it's Dr. Bender, you're first.
Hi, I'm Bender. I'm a pediatric hematologist, and I run the Sickle Cell Clinic out of Odessa Brown Children's Clinic.
Thanks, Bender. And Alex.
I'm Alex. I'm a nurse practitioner. I have the best job in the world. I get to split my time between pediatric primary care and pediatric sickle cell care. And I'm also based out of Odessa Brown and Seattle Children's.
Thanks, Alex. And last but not least.
That must leave me. My name is Martin Makala. I'm a physician at the University of Washington Emergency Department. I'm the medical director here, and I also work at the Harborview Medical Center Emergency Department.
Thank you. All right, let's start real quickly about the overview. And Alex, I think you're going to share with us, just give us a history, like what is the flu, an overview of the flu.
Yeah, absolutely. So influenza is a viral infection. I think a lot of people, even in my own community, use the word flu to describe things other than influenza. Like a lot of times people will use the word flu to describe a stomach bug, when in fact, influenza is a viral infection that causes fever, cough, congestion, body aches. It usually puts you out for 3 to 7 days. And you get pretty sick. Last year, so I'm going to read some notes on another screen. Last year, the CDC estimated in the United States that 35.5 million people got influenza, 16.5 million people sought medical care, 490,000 people were hospitalized, and 34,200 people died from complications from influenza. So it is a pretty serious infection for yourself and your body, but it's also a very big public health concern. There was a pandemic, the last pandemic we experienced was in 1918, and that was an influenza pandemic that killed an estimated 50 million people worldwide, which is insane. And that particular influenza strain really hit hard young people. So people ages 18 to 30 had, for some reason, a higher mortality rate. And what's super interesting is the influenza virus that we see every year still is that same strain from 1918, but every year it mutates and changes. Influenza has never left planet Earth. It just travels around. And so it really likes to hang out in small closed spaces where people are maybe breathing on each other, hugging, sharing that airspace. It likes to travel on airplanes between the southern hemisphere and the northern hemisphere. So here in the northern hemisphere, we see influenza usually between like October and March, whereas in Australia or South Africa, they really see it at the opposite end of the spectrum. And so it's just constantly moving around the world and constantly evolving. And so every year, really smart scientists in a lab are trying to guess how it's going to evolve the next year. And so every year we're having to create a new influenza vaccine. And all of us that work in healthcare really care a lot about this vaccine because of how serious influenza can be and how not only how many people seek healthcare for it, but like how many people die from influenza every year. And it can be prevented. The influenza vaccine's very safe. It's very effective. You might hear that some years it's more effective than others, and that's because scientists are trying to predict, again, how the influenza virus is going to mutate, and sometimes they're better at predicting it some years than others. The influenza vaccine, again, very well tolerated, but you do have to get it once a year, sometime between that October and March time span. We do recommend getting it earlier so you're protected for that the season. The influenza vaccine reduces transmission, reduces the number of cases, or if it's one of those years where maybe it's not as effective and you still end up getting influenza, we expect your course, so the height of your fever, the length of the illness, all the complications that you could get from influenza, to be much less than had you not gotten the vaccine. And then the one other thing I wanted to mention, so Foxy had presented a question of who in the home should get the flu shot. And my recommendation is that everybody in your home should get the flu shot every year, but especially this year. And Bender will go into more about that. You know, everybody's immune system is a little bit different. And it takes your whole community, our whole community, including your household and people in your more wider bubble, being protected and being safe to keep you as somebody who's living with sickle cell especially safe. When I think about the flu shot that I've gotten the flu shot every year for probably the last 25 years. It is something that I don't only do for myself and my health, but it's something that I'm doing for my patients, and I'm also doing for my community at large. That's my spiel.
Awesome. Well, thanks, Alex. Really appreciate it. One question just to clear up. When you get the flu shot, how long is it protecting you? Does it protect you from October? If I get in October, does it protect me all the way till October, or is it a...
Great question. So we think that you get roughly 6 months of pretty good immune coverage with each yearly influenza shot. So, you know, by getting it in October, we think that you should be pretty well protected until March. But again, the scientists have developed that vaccine to work for this year's flu vaccine. So if you don't get your flu shot until March, when you see your provider again in November, they're going to recommend that you get that year's flu shot too.
Okay, great. Thanks so much. Thanks so much.
Good question.
And now can we go a little bit narrow into sickle cell? I know Dr. Bender can just give us a history of the flu in sickle cell community.
Sure. No, I think that's a really important topic, and I agree completely with what Alex was saying in terms of the importance of immunization. The flu with sickle cell is tough at multiple levels. First, there's a misconception. A lot of people think people with sickle cell get the flu more easily. There's no evidence of that. The issue is more that if they get it, the consequences may well be higher. And there's several good reasons for that. First of all, as most people know, the flu is really good at attacking your nose, throat, and most importantly, your lungs. And in sickle cell, you're already at risk for lung problems. So now you've got a double whammy there. The other thing is, we all know in sickle cell, it's important to keep track of triggers for vaso-occlusive or pain events, right? Some of those include inflammation, any irritation inside our body, or high white blood cells. Well, when you get the flu, your white blood cells go up to help fight the flu, but that slows blood flow through the small blood vessels, making it more likely for red blood cells to sickle and cause pain events. Okay. And then also it causes generalized inflammation, and that inflammation is trying to fight the infection, but again, it slows blood flow, making it more likely to get sickling to occur. And then the last thing is, every day in a normal situation, our body is covered with bacteria. You know, a lot of them are protective. The problem is when something lets them get inside our body, and we've got lots of walls or barriers to protect ourselves. Our skin is a great one. The lining of our nose, our throat, our lungs are important ones. Inside the tubes, some of the tubes in our lungs, there are teeny hairs that help brush infection and garbage and debris out of our lungs. But when you get the flu, that irritation where you got dripping in your nose, the sore throat, and that redness, that's a breaking down of the wall. So it's easier for the bacteria to get into your nose, into your throat, deep into the bloodstream from your lungs. It can paralyze some of those little hairs so it can't fight things. So it makes it easier to get bacteria infections when you have the flu. Pneumococcus, the bacteria that causes ear infections, often people also call it strep pneumo or strep. That's what used to kill so many infants with sickle cell years ago. That doesn't happen now because of newborn screening and penicillin and immunizations for that. And so now it's really rare. But in sickle cell, many of those severe cases of strep infections occur in people that have the flu. And that just fits with the idea of you get the flu, it breaks down your barriers, it's easier for bacteria like strep to get into your bloodstream. So it's really that combination of the flu and sickle cell really sets you up, which makes prevention and early intervention and immunization all the more important.
Awesome, thank you. And can we come back to the question, therefore, what I think we're all agreeing is we should get the flu shots this year, hands down. But in a family that has someone who has sickle cell, can we come back to who should get the flu shot in that family? I'm assuming everyone, but I just want to make sure that that's very clear.
Yes.
Everyone should.
Yes, everyone should get the flu shot. Yeah. And this should be a conversation that you're having not only within your family, but within your immediate community. So hopefully everybody has created somewhat of their little COVID bubble, right? And so if there's anybody in your COVID bubble that you're seeing that doesn't live in your household, you should be having conversations with them about the influenza vaccine as well. Again, not only for them to protect themselves, but for them to protect you and for them to protect our community at large. One of the reasons, again, every year we want you to get the flu shot, but one reason why this year in particular, we're really having these conversations is because of COVID-19 and what that is doing to our healthcare system and how we expect that to continue to burden our healthcare system and our healthcare providers, and particularly places like the UW where Martin works over the course of the winter. If you are worried about COVID-19 and you want to do something to help, getting the flu shot for yourself and your loved ones is a tangible thing that you can do that can help keep our hospitals open and able to continue to care for COVID patients that have COVID-19.
Awesome. Can we address one question I know that has come up, and it's partly, you hear so many things. With COVID, you hear so many things. One of them was this myth around COVID. If you have the flu or if you get the flu shot and you get COVID, that you're going to experience intense respiratory issues more so than if you didn't have the vaccine. And I just want to address that. That has been something that has floated around. Can anyone speak to that?
Thank you for bringing that up. I mean, first, flu season is early, right? So we don't have much experience with the two combined. But from combinations of other viral infections before, it's pretty straightforward. Two is worse than one. And it's usually what we say is synergistic, right? What's that mean? Additive is 1 + 1 = 2. You get problems from one, you get problems from the other, and together it's like the combination. Often when you get two, it's synergistic, 1 + 1 = 3, that it's much worse than the flu problems plus the COVID problems together because they interact to make each other worse. So it's really critical to prevent both of them, right? Flu vaccines, masks, hygiene, looking at how you're moving through life to prevent infections, whether it's COVID or flu.
Awesome. And to a person who's really just not feeling well, not sure how to identify, sometimes the symptoms can be meshed. They're just not feeling well and they feel like they're not managing this at home. Dr. Martin, can you speak to, I got to go in. I just can't manage this at home, but families are obviously very concerned right now to go to the hospital. Can you just reassure what's happening at the hospital level if you do have to go in?
Yeah, I'm happy to. I work here at the University of Washington Emergency Department, but really all emergency departments across the state are functioning in very much the same way. And that is to isolate people who have respiratory symptoms from those who don't. So if you feel bad at home, I don't know when you're coming in the door, if you have influenza, if you have COVID, or if you have, far more likely, any of the other respiratory diseases. But we know that we don't want you to share that with anyone else in the department. So we have strong separation policies really in our waiting room. We have extra room available. We keep people within the social distancing. Everyone in the hospital has to have a mask on. And in fact, we are limiting the number of people who can even come into the hospital for that reason. So we have a very strict one visitor policy in our hospital, in the emergency department and elsewhere, because we want to keep people out of the hospital. So I absolutely agree with you. If you are feeling bad enough at home and you're starting to get scared and not sure what's going on with your lungs and you feel the need to have health care, if you can't get a hold of your primary care doc to talk about those plans, you need to come and see me or any other emergency department. I think we do a pretty good job at University of Washington because of our connections with children's and with this group. But really, if you're somewhere and you need to be seen, they will protect you. So there's two sides of this. One is if you're sick enough to come in, we will take care of you. We are ready to do that. The other side is if you're not all that sick, you should stay home until you know what's going on and be in communication with people. We are, again, really limiting the number of people that we're trying to bring into the emergency department, into the hospital at all. And we're cutting down on visitors. But we do have the waiting room set up so that you're separated from other people. Obviously, all of the things that you're already doing, hand washing and those type of things, we have set up as well. We have specific areas for people to stay away from those who have respiratory diseases. So it's really not special in my case for anyone with sickle. This is the same as we do for anyone else. But if my family were sick, I would bring them to my emergency department knowing that I'm protecting them from people who are also sick. The advantage we have in the emergency department at University of Washington is we have single rooms. And so you're in a single room alone. Some emergency departments don't have that ability and you're in an open bay with other people separated only by curtains. Even there, we're separating people far enough that it's not an issue. It has not been an issue, but we are going out of our way to keep people safe and make sure that we're still available. And I really want to comment one quick moment on Alex's comment about protecting the community, because the flu shot is one way that we can keep people out of our emergency departments. And we don't know what the future holds for COVID or any other disease, quite frankly. And so we have to keep people who aren't sick out of the emergency department so people who need to come to the emergency department can get in. So everybody needs the flu shot. You can't give the flu to someone by getting the flu shot. You can't hurt someone by getting the flu shot. Please get your flu shot so that we can not only protect you and your loved ones, but really the whole community.
And following up on what you just said about protecting others in the emergency department and staff and not bringing in people, that's also so important with clinic. Okay, there's lots of screening going on. No matter what is going on with your health, we will make sure you get taken care of. Don't hesitate, okay? The big question is, where is the best and safest place for you to be seen? So please, for clinics, it's different than the emergency department. We're not set up as well for just anything that happens. It's best to call first, let us know, and we can help tell, yes, you should come into clinic. Yes, you should come to clinic, but we're going to have to take special precautions, or you should just go to the emergency department. And then most importantly, when you get there and they screen you at the door, please be straightforward. If you've got symptoms or problems, we will take care of you. but be honest. Those questions are being put in place to make sure that staff, family members, people in the community, in the building are protected in case you're infectious with something.
This is great. This is really informative. Thank you so much to all of you for taking the time. And, you know, the sense that I get from this is that we all can play a role and we have a communal responsibility, which sometimes you don't think about when you think about the flu shot. So I love that you guys were able to kind of just bring that out. We want to make sure that we keep our families safe, but we also want to look beyond our own households and look to community and making sure our healthcare workers stay safe and the clinics stay safe and that our neighborhoods and the people in them stay safe. So we just want to encourage you. I hope this was informative. If you have more questions, you want to keep dialoguing, please feel free to reach us. You can reach the task force on our website, www.mssctf.org. We have a Facebook page you're welcome to go to. If you have a question for a specific doctor, feel free to put it in the chat, and we will send it off to them and make sure you get your questions answered. But I hope that what you take away is it's not a fear. We should get our flu shots as a way of loving our community and loving our family. So again, thank you so much for your time. Thank you all of you for showing up and just giving us some great information. And we'll hope that everyone stays safe during this time. Bye.